We mentioned earlier that it is National Wear Red Day with the American Heart Association. It's also World Cancer Day. It's aimed at raising awareness and money in the fight against all of those types of diseases. A lot of important work is happening at Roswell Park Comprehensive Cancer Center here in Buffalo. And it is now the first place in the world to use a new immunotherapy for the most common type of brain cancer. Now, this is called SurVaxM. We've been covering it for years. It's a vaccine against glioblastoma, which has a median survival rate of just 16 months, even with surgery, chemo, and radiation. Now, this was developed at Roswell, and early studies have found that it increased the one-year survival rate of patients from about 65% up to nearly 94%. Now, Roswell will be one of 15 centers around the U.S. and China to be part of a next phase of clinical trials. They're testing it on cancer patients with the hopes of extending their lives. Dr. Michael Ciesielski is one of SurVaxM's inventors. He says it could be a big breakthrough in treating that cancer.
Standard of care for glioblastoma hasn't changed since about 2005 with the last approved drug that was introduced. So this will be the first time that we're able to see if we can do better than standard of care. We already know this from our previous trials where we've seen great results, but it's never gone head to head with the existing drug. And so this is the new challenge for us.
And so the researchers are enrolling 100 patients in this trial over the next 18 to 20 months. If it is successful, it moves up to an even bigger trial. Dr. Ciesielski told us that it's gratifying to see something developed right here in Buffalo making this kind of impact, as well as to see that firsthand.
As a researcher, you don't usually see that because we're not necessarily in the clinic treating the patients, but from a step away, we see the patients coming back for more and more doses. We hear of the patients doing really well. And in the past, with standard of care, that's not something that we've heard too often. Standard of care doesn't do much for the disease. Glioblastoma is incredibly aggressive and super resistant to therapy. And this is one of the first times we've seen that needle moving. We see a dent in glioblastoma's armor, and we see these long-term survivors. And that's really special to myself as a researcher to be able to see that, to know that I've got a hand involved in that process and helping a patient.
And he also wanted to take some time today to thank everyone who participates in events like the Ride for Roswell, because that raises money that is able to fund this type of research and make these types of discoveries.